Welcome, everyone. We're going to get started with our program. Thank you so much for joining us. And we are so grateful to have you at our conversation and webinar today on dark work, devalued, unprotected, protecting Black workers in the time of COVID-19. And we're so grateful to our host, the Mississippi Worker Center for Human Rights, and really grateful to all of the panelists that I'm going to introduce um, uh, just very briefly. And we're very excited for this conversation to center Black workers. We are a day past the National Workers Memorial Day. So this is also an opportunity for celebration, for reflection, and for insight. We welcome all of our panelists who are going to share with us about their work, their strategies, what they're seeing, and really lift up the experiences of Black workers and Black communities in this moment in time. And we're just grateful for this opportunity to be together and to create some spaciousness to really center the needs and the issues and the joy and the resilience of Black communities and particularly Black workers. A couple of sort of housekeeping items is the webinar will be recorded and it also will be sent out after the completion of the webinar, probably in the next day or two. We also have a chat function, so we welcome you all to share your questions and your reflections in the chat, and I'll be doing my best to lift those up to our speakers. And I also just want to recognize that this is truly an unprecedented time for all of us, and just very grateful for this space to be here together. I also know that it may be weighted for some of us. We're navigating work and loss and caregiving. So I also just wanted to take a moment to give everyone an opportunity to really sit in your body and to think about what anchors you and what resources you. So I'm just going to give folks a few seconds to think about that. And so I hope that the places, things, people that anchor and resource you be a part of this conversation. And so what I'm going to do now is I'm going to introduce our speakers very briefly, but then as we go through each section, each speaker will share more about themselves and their organization. And so my name is Kemi Rollet. I'm the Director of Work Equity at the National Employment Law Project. And today we have with us Jaribu Hill from the Mississippi Worker Center for Human Rights. We have Fran Marion from Stand Up KC and a worker leader at McDonald's. We have Rebecca Dixon from the National Employment Law Project. We have Rickey Thompson from Concerned Citizens for Justice. We have Nana Gyamfi from Black Alliance for Just Immigration. We have Aimée-Josiane and Linda Walton, who are from National Domestic Workers Alliance. We hopefully will have Christian Smalls on the line, who is the lead organizer of Amazon Strike, and also LaToya Harris from the LA Black Workers Center will be joining us. We have LaToya Lewis, who is with Stand with Dignity of the New Orleans Worker Center for Racial Justice, and Jayanni Webster, who's a Southern Labor community organizer, and Greene, who's from Resist the Rona and Right to Vote. So thank you all for being here and very excited for our panel. So first I'm gonna start with introducing our first speaker, Jaribu Hill. And I'm gonna slide to Jaribu's biography just so that I have that here. So Jaribu Hill is the founding executive director from the Mississippi Worker Center for Human Rights. Jaribu is a human rights defender, a people's lawyer, an author, and a cultural artist. Jaribu is also the founder of the Southern Human Rights Organizers Conference, otherwise known as SHROC. And as the founding director of the Mississippi Workers Center for Human Rights, Jaribu has joined with the center's members to create and launch campaigns against workplace hate violence, employment discrimination, and sexual harassment. Jaribu is the author of several articles and publications, including Knowledge is Power, a Know Your Rights Manual. As a resistance artist, Jaribu is a freedom singer, a poet, and a prose agitator. Thank you so much, Jaribu. You're still on mute, Jaribu.
And I knew that I would do that. Thank you, Kemi, and welcome to everyone, our panelists, as well as the audience. Thank you so much for taking the time out of this most stressful time to be with us and to unite our forces together to make a difference. I am to set the context for why we are centering Black work, why we're centering dark work, why we're centering Black laborers, Black workers. Dark work devalued and unprotected. My dedication is to those who survived the Middle Passage and those who did not. 1619, more than 400 years ago, we remember the kidnapped, the enslaved, the strange fruit, the chattel workforce, always resisting terms of bondage as business. With gratitude for the swollen fingers, scarred backs, and charred flesh, for those who went our part, paved the way, and never got the chance to see it through. The auction block was the headquarters for logging in stolen labor to toil for life without compensation, rest or relief, to toil after beatings and rapes, after the rope, after running away to get free. The slavocracy, now described as workforce, as corporate, as law, still. Small wages and even smaller benefits and no job security. The right for close to nothing wages and no wages if you demand more or step out of line. No rights the system of white supremacy is bound to respect, and Dred Scott taught us that. The history of work here in the United States cannot be separated from the system of capitalism and all of its byproducts, racism, patriarchy, and classism. Under this brutal system, dark-skinned work has and must always be devalued. The masses must remain poor and dependent for that system to survive. The masses must always be exploited for capitalism to thrive. Today, we remember, as Kemi said, yesterday was Workers' Memorial Day, and continuing throughout the week called Workers' Memorial Week, we are lifting up workers who've lost their lives while trying to make a living. In this program, we focus on Black workers, sweat and toil and blood shed for profits of the rich, while the poor starve and die, working in Jim Crow hellholes without protection, assigned to dirt, danger, and death. During this week, we remember them and call their names. I never tire of calling the names of Cole and Walker, Black sanitation workers who were seeking shelter from the pouring rain when they jumped into the back of a garbage truck and were crushed to death. Sanitation workers who had known the indignities of dark-skinned work and always had been set aside, died February 1st, 1968. Remember their names: Echo Cole and Robert Walker. Echo Cole, 36 years old, Robert Walker, 30 years old. February 1st, 1968. Their deaths sparked the I Am a Man movement, the I Am movement. Capitalism is the enemy of the sufferers. For Fannie Lou Hamer, who sharecropped when crops were not shared and stood up for all of us. For Imperial Foods poultry workers who died in Hamlet, North Carolina, trapped in the plant because the boss blocked the fire exit with an 18-wheeler truck to keep workers from allegedly stealing chickens. And we remember those workers today. 21st century death traps masquerading as workplaces where dark work is the backbone for the money machine. The dark work assignments continue. Mississippi laundry workers, washing, drying, and folding linens for hospitals and fine dining institutions without protection, ventilation, or clean drinking water. Miscarriages on the plant floor because pregnant workers are denied water. Working too close, no masks or gloves, devalued and unprotected. In crowded kitchens, in fast food restaurants, Black workers are forced to work without PPE, pushing burgers, fries, and breaded fish through takeout windows. Essential work is dark work, is mandatory, is devalued and unprotected. For the past 23 years, the Mississippi Workers Center has stood on the side of Black workers and their families. In this time of pandemic, we join with our members in worker circles in creative ways to keep in contact, phone banks and telephone actions and sessions, to work with those who have always suffered the most as they struggle to rebuild their lives and foster change in their workplaces and communities. I end by saying that the Mississippi Workers Center was founded when R.W., and I withhold his name to protect the innocent, when he sounded the alarm in the poultry plant that he was working in 1996 and shed a light on modern day slave plantations in the food processing industry. His courage led to him being terminated and denied unemployment. We must stand with those who are too essential to shelter in place, to stay home when sick, fired when they have to stay home to care for their children who are out of school because of COVID, fired when they are diagnosed with COVID, fired when self-quarantined, disposable, devalued, and unprotected. We stand with Black workers and support them in their demands for equal protection under COVID and beyond. The chattel work is still with us. The auction block enterprise is still with us, and so is resistance. Welcome to the conversation.
I just thank you, Jaribu, for that grounding, for that testimony. The auction block enterprise gave me chills. I'm gonna need to reflect and sit with that for a minute, but just thank you for setting that context and creating the room for all of us to step into this conversation. And I'm so excited to introduce our next speaker, Sanchioni Butler from the Mississippi AFL-CIO. And Sanchioni is a Southern-based organizer with 15 plus years experience in labor and community organizing. She was the lead organizer for the high-profile Nissan campaign in Canton, Mississippi. And Sanchioni believes that the common thread through all of these experiences is the innate belief that our institutions will only flourish if members and future members are given the tools to advocate for themselves. So grateful to have you.
Good afternoon, good evening, everyone. First, I just want to thank thank the Mississippi Workers Center and Executive Director Jaribu Hill, the organizers of this virtual program, sponsors, and the speakers who are willing to share their courageous stories today. Just also want to thank you all for allowing me the privilege to bring greetings this evening on behalf of the Mississippi AFL-CIO State Federation and the labor movement. As we reflect on Workers' Memorial Day yesterday, we know that this brings us together to remember the sacrifices working people make every day to provide for their families, because they just want a piece of the American dream. Every day is a reminder of the dangers a worker faces in the workplace, either from a workplace injury, occupational diseases, and now this horrible pandemic that we're going through. We know that there are so many companies that still have not taken the steps to protect its workers, our frontline workers. However, we must continue to stand together and hold these companies and our elected officials accountable to do what is right for at-risk frontline workers now, and also continue our efforts. Even when this pandemic is over, we must continue to highlight dark work, the devalued, and the unprotected each and every day. Thank you so much.
Thank you so much for bringing those greetings, Sanchioni. And before we move to our next speaker, Fran Marion, we're going to show a short video.
I've worked at McDonald's for over 10 years. I'm that face that you see that serves you your hash brown for breakfast, maybe a quarter pounder for lunch, and they even gave you a McFlurry to top off your dinner menu. So I ask you, if I caught the coronavirus, would you want me making your next meal? There are 500,000 McDonald's workers just like me that have to go to work, whether sick or well, because we have no paid sick leave. I currently make $11.50. I live paycheck to paycheck. The sixth day for me is lost wages. I literally have to be damn near on my deathbed to take a full-blown sick day. The missed check is the difference between me having a roof over me and my family's head versus us being homeless.
Welcome to McDonald's. May I take your order?
McDonald's is one of the largest employers in the world. There are hundreds of thousands of McDonald's workers that touch millions of customers' food each day.
There is nothing so clean. That's my burger machine.
The CDC found that 20% of food service workers go to work even exhibiting signs of vomiting or diarrhea. And I should know, I'm one of those workers. Last week, I was under the weather. I was sick to the point where I had to leave the grill to go to the restroom, and I wound up vomiting. And I could have been sent home with paid sick leave and not have to worry about coming to work sick, because I don't have to worry about how my bill's going to get covered for the days that I missed.
Hello, McFamily.
Last week, McDonald's did roll out a coronavirus plan stating that anybody that's quarantined will be paid.
Protecting well-being of our people and our customers is our #1 priority.
But you guys, don't be fooled. That's only for corporate-owned McDonald's. But 95% of McDonald's are franchise stores, including my store. So that does not benefit us whatsoever.
Today, the Senate has taken up coronavirus legislation.
This week, the government passed a law that enables people that have the coronavirus to get paid time off.
2 weeks of paid sick leave. The bill does have an exemption for businesses with 500 employees. Depending on how you look at it, it only covers about 20% of workers.
Republicans made it so that doesn't apply to big businesses, such as McDonald's. And listen closely, that's only with the coronavirus. What about the flu? What about the next outbreak? What then? McDonald's has the power to make it so anybody in a McDonald's uniform that wears the McDonald's logo, like I do, could be provided with paid sick leave, especially during this critical time. Companies can change this. Since this coronavirus pandemic, Olive Garden has given their employees paid sick leave, not just during this time, but for good. So we know that McDonald's, Burger King, Wendy's, Subway, they can all do it as well. but they just have chosen not to. McDonald's could provide paid sick leave for hundreds of thousands of its workers right now, here today. Well, with that being said, off to work I go. Y'all have a blessed day.
Fran, thank you so much for being with us today, and thank you for your deeply powerful words that we just saw in that video and that we're also going to hear from you. Fran is a leader and organizer with Stand Up KC. She's currently one of the leadership of Stand Up KC's Fannie Lou Hamer Women's Committee. She has fought for raising the minimum wage to $15 and other very important efforts that impact workers across this country. Recently, as we saw, Fran shared her story of being a McDonald's shift manager with the New York Times, highlighting how McDonald's has failed to provide paid sick leave for all of their workers. The video has been viewed by millions of people across the world. Welcome, Fran.
Thank you for having me, you guys. Hello, everyone. As you already know, my name is Fran Marion, and I am a McDonald's worker here in Kansas City. I'm a single mother of 2 teenagers, as you guys got to see my daughter in the video, Raven and Rashad, and I'm a leader in the Stand Up KC and a fight for $15 in the union movement. You know, we have been organizing, speaking out, and going on strike for the past 7 years, and our fight to raise the minimum wage to $15 per hour and to win a union in the fast food industry. We made a lot of progress in that time. We won a combined $70 billion in raises for 24 million workers across the country. We won $15 minimum wage in 7 states and dozens of cities. But you guys, it's still not enough. Millions of workers like myself are still getting up every day and going to work, but being forced to raise our families in poverty. Even before the coronavirus, my life was a struggle. Although I have 20 years experience working in the fast food industry, half of those years spent working for McDonald's. I only make $11.50 an hour every 2 weeks. My checks would average about $750. That's $1,500 per month. My rent is $650 just by itself. So there goes my first check. And then I still have to worry about paying lights and gas, not to mention keeping food in the house and taking care of my kids and their needs. So therefore, before this pandemic started, we were already living on the edge. My family and I have experienced homelessness before. We have dealt with having our lights cut off and living in a house to where the water was cut off. I am fighting like hell to make sure we don't fall back into that situation. And it pisses me off to think that while I am worrying about just keeping a roof over my kid's head and busting my tail to do it, McDonald's made $5 billion in profits last year, but acts like they can't pay me at least $15 per hour. And it's not just our pay. McDonald's doesn't give me any health care, and we don't get any paid sick days. We don't have a pension plan. I suffer from high blood pressure and have my own mental issues. But I try to avoid going to the doctor because that means going to the emergency room and raking up another bill. And I can hardly tell you just how angry it makes me knowing that my kids also don't have health care. And you all saw the video that I did with the New York Times, so you also know that McDonald's is the largest employer of workers with no paid sick days. Sometimes it feels like McDonald's expects us to work like superhumans while they pay us and treat us like we are less than human. Now let me tell you a little bit about how things have been since the pandemic started. The reality first set in for me when I got a phone call from the superintendent of my son's school district, and I was informed that school was canceled for the rest of the year. Now, thankfully, my son and daughter are old enough that I don't have to juggle childcare like millions of other parents are dealing with during this crisis. But I won't lie, having to provide 3 meals a day for my son instead of 1 takes an extra toll on my budget. He's a football player, you guys, and he eats just like one. And then it set in on me. I'm going to have to work during a pandemic. And ever since then, I feel like I've been living with a cloud over my head, worried that I might get the coronavirus from a coworker or a customer and bring it home to my kids. But I have no choice but to keep going to work because I still have bills to pay. And you know what's funny? All these years we have been fighting to demand living wages, benefits, and a union, and ultimately the respect that every worker deserves. And now we are finally called essential workers. In a way, it does feel like a small bit of recognition for our hard work. But as the saying goes, actions speak louder than words. We are called essential workers, and we are essential workers, helping to feed America during this pandemic, but we're treated like second-class citizens. Our lives are literally on the line, but we haven't received so much as a penny in terms of hazard pay. I think an extra $3 per hour should be paid to every worker who is putting his or her life on the line and being exposed to the public during this time. Since the moment that this pandemic began, we haven't had a single staff meeting or training session so that we can be educated on new policies on how to best handle things during this crisis. McDonald's keeps us totally in the dark. McDonald's says that they've closed their lobbies and went to drive-through only. But I'm here to tell you, not at my McDonald's. Customers are still coming in and coming out, placing orders, and using our restrooms. It's impossible for us to do social distancing. We can't stay 6 feet away from our coworkers, and we can't stay 6 feet away from the customers. One of my coworkers had to tell a customer she couldn't sit down in the lobby the other day. The woman snapped and called her everything but a child of God and told her she was going to beat her up outside. These are the kinds of things we deal with for poverty wages. Although our store is still open, business has slowed down and most of us have lost hours. So now I'm only getting 30 hours a week instead of 40. That means I'm getting $500 a check after taxes instead of $700 a check. So my income is reduced, but my rent hasn't changed. It feels like I'm pressed against the ledge and somebody's trying to push me off. The only thing I can do is dig my heels in and fight. Because of the organizing and speaking out that we have been doing, we have been able to win some victories in my store and other McDonald's locations across the country. We won cough guards, gloves, and masks, and we got temporary paid sick day policy for the coronavirus. Basically, it says that if you get coronavirus or if you have been exposed to it, then you can get 14 days paid sick leave. But here's the thing. Like I told you guys earlier, we don't have health care. So that means that we have to go to the emergency room and rack up another bill just to get the test that proves whether we have the coronavirus. Or what if we get sick with a cold or the flu? That's not covered. What about after all this is over? Why doesn't McDonald's just provide paid sick leave to every single McDonald's worker across the board? Always, everywhere. That would be the right thing to do and the healthy thing to do for the workers and for the customers. And that's why we're continuing to fight to win a union. We want to be able to have a say-so over our lives, especially during times like this. In the end, a union is just an organization of workers who come together to get things done together that nobody, as one individual, can get done on their own. A union is how workers can make sure that our voices are heard. A union is how we can bring democracy to the workplace. Nothing about us without us. Now I want to conclude by talking about the coronavirus. One thing for sure, the coronavirus has tragically proved two things at the same time. It has revealed so many of the inequalities that our society has allowed to fester, in particular, the inequalities of race and that of class. From state to state, data shows that Black people are disproportionately likely to die if they catch the coronavirus. Let me say that again. Black people are disproportionately likely to lose their lives if they catch the coronavirus. That's unacceptable. And it's a grim reminder of how far we still have to go in terms of racial equality. Black and brown workers are disproportionately likely to be working on the front lines of this pandemic in grocery stores, hospitals, warehouses, and fast food restaurants like mine. We're also disproportionately likely to get laid off entirely. Immigrant workers have been totally left out of the CARES Act. They won't even get a $1,200 check in the mail or be able to file for unemployment. It's worth pointing out that 55% of Black people live in the South where the minimum wage is the lowest, where there are the fewest unions and where the state governments have refused to expand Medicaid. And it seems they have refused to even accept they were in the middle of a pandemic, as the states in the South were the slowest to enact stay-at-home orders, and now they're going to be the first to get rid of them. So it all goes back to what I was talking about before. Black people are less likely to have health care in America. We're less likely to have a living wage. We're less likely to be able to work from home. We are less likely to have wealth and saved up for a crisis like this. All that means we're more likely to have pre-existing conditions like that of asthma, diabetes, and high blood pressure, more likely to live in poverty, and more likely to die because of this pandemic. It's wrong, and it should light a fire deep inside of every one of us to demand justice and equality, not for ourselves, but in the memory of all those that we have lost. The coronavirus has also revealed just how much we are all connected across America and even around the globe. If I get sick, you could get sick. I'm making your food after all. It reminds me of what Fannie Lou Hamer once said, that nobody's free until everybody's free. And in the labor movement, we have a similar saying, an injury to one is an injury to all. Now let me say what that means to me. It means my issues are your issues, and your issues are my issues. As working people, we're all tied together. There's a thread that runs through all of us because in order to survive, we have to get up and go to work. We are the working class. We are Black, white, and brown, Asian American, and Native American. We are male, we are female. We are gay and straight, and we all deserve to be free. Every single one of us. That means a living wage, good health care, paid sick days, a safe workplace, and respect and dignity. That means good schools, safe neighborhoods, and a clean environment. And I believe that if we build a massive multiracial movement of workers across the country and we take action together, we can win. There is strength in numbers, and there are more of us who get up every day and go to work than there are CEOs. But our strength in numbers only works if we unite. We gotta come together and we gotta stick together. And then we have the courage to stand up and fight. If we do that, I believe that we will win economic justice and racial equality, and we won't get one without the other. Because as I say, united we stand, divided we fall. Thank you.
Let's just take in that powerful testimony. Fran, thank you so much for all of those words. I'm seeing, reflections in the chat, a deep appreciation for you. You are a hero. Thank you for all that you framed for us. And one of the things that I think is really powerful, both from the comments that you've just made and that Jaribu made, is that really illustrating the ways in which white supremacy, racism, and specifically anti-Blackness has been a deep economic driver of the US. And it shows up in all of the compounding systems that exploit workers that you named. And it also shows up in the ways in which then we as workers have to shoulder the burden. And specifically as it relates to this pandemic, I heard you speak to the ways in which you have to shoulder the burden of maintaining your health, maintaining the health of your loved ones and community, and also maintaining the health of those who are still coming into your McDonald's store. And the other thing that you beautifully framed for us is just how much building worker power is essential to any strategy, any talk of pandemic, recession, recovery. And you started to talk and give us some examples of the works that you've done, but I wanted to ask you, how did you get to this point? You've been doing this work for 7 years. How have you been investing in building your power and building the power of the workers around you?
It starts with me organizing in my workplace and talking to my workers, and just asking them basic questions. If you were able to make $15 an hour, how would that make your life different? How would that better off make things better for you? How would having a voice on your job better help you and bettering yourself and bettering your family? And then that's where it starts from. It starts with the education. Let me educate you on from going back from the civil rights movement up to now, because I believe that the fight they're all involved in stems off the shoulders of the civil rights movement. We're just carrying it on in this time. And that's really where I start from, is in my store and organizing my people. And then from my store, it goes into my community. And for me, even in my household, both my kids, they're mini organizers, they're mini workers, you know, and they're getting out there. My daughter's a manager at McDonald's as well, another location. And, you know, she's starting off fresh and she's getting into it, you know. So it just starts with that education and educating my workers and the people within my store to let them know that this is a real fight. If you're truly tired of this struggle, then you got to stand up and you got to be heard. Because if you sit on the sidelines and you say nothing, then your voice goes on unheard, you know, and then you want to see you get in the struggle. You know, it's like the same thing with voting. If you don't get out here and vote, everybody complains about having Trump as president, but if you don't get out here and vote, what have you done to change that? And, you know, and how I got involved in the Fight for 15, you know, was I was working at actually a Popeyes location, and I was new here to Kansas City, and some of my brothers and sisters were involved in the fight. And I was one of those skeptics, like, you know, you guys, y'all blowing smoke up my tail. I don't want to hear none of that, you know. And then I actually got to see them firsthand when they came and struck on my store, and I listened to all my brothers and sisters on the stuff they were fighting for: better safety equipment for our stores, you know, paid sick leave, you know, respect, basic human rights, you know. And at that point in time, I knew that I had to do something, because I could stand behind on this side of the counter and say, I agree with you, and just stand there and do nothing. I can say, I agree with you, and I can walk out and I can join you and I can fight side by side of you. And that's what I did, and that's what I've been doing ever since. I hope I answered that question.
No, absolutely. Thank you so much. And thank you so much for lifting up too, that often where we start is where we are, right? Our sites of work, our families, our communities. And, you know, what I thought was so powerful of what you said is that in your organizing, in building power, that you're also starting with the vision of where do we want to go? What do we want to make possible? And you're grounding it in our lineage and our history, but we're always focused and tracked into what is the vision of possibility for us as workers, as Black folk, as folks of color. So thank you so much for lifting and sharing your story in those words. And I know that folks will have more questions for you as we get to the Q&A part. And I'm gonna pivot to our next speaker, who is Rebecca Dixon from the National Employment Law Project. And Rebecca Dixon is the Executive Director of National Employment Law Project, NELP. And as Executive Director, Rebecca leads NELP's work to build and contribute to a strong workers' rights movement that dismantles structural racism, eliminates economic inequality, and builds worker power. Rebecca's motivation for advancing workers' rights and commitment to economic justice is deeply rooted in her lived experience growing up in rural Mississippi at the intersection of race, class, and gender, characteristics that have long defined our ability to participate in our democracy and our economy. Welcome, Rebecca.
Thank you, Kemi, and man, hard act to follow, Fran. I want to pick up where Kemi left off. So what do I mean by lived experience? Well, what I mean by lived experience is that in the summer of 1995, as a college student, a very broke college student, I returned home to work in Mississippi for the summer, and my job was working in a chicken processing plant. And if you know anything about chicken processing plants, you know that those are tough environments to work in. They're cold, you're handling very sharp knives. And I consider myself a tough person, but I was not tough enough to tough it out. So I ended up working the rest of the summer at Walmart, the store. And so when I say lived experience, I mean lived experience, not theoretical, like understand what it's like to be an underpaid worker. The work that I did has historically been undervalued because it has been done by women and workers of color. This work and the people who performed it were left out of the New Deal, left out of the right to organize, minimum wage, overtime, Social Security, unemployment insurance. At NELP, we fight so that all workers have dignity, economic security, and a voice at work. In collaboration with national and grassroots partners, we use research, advocacy, litigation, policy support, and technical assistance to build a just and inclusive economy where every single job is a good job and everyone who wants a job can get one. We help to make jobs safer and to help workers bring home higher pay. The rest of my remarks will focus on occupational segregation and its impacts during this pandemic. So when I say occupational segregation, I mean, if we think about just a few years ago in the Obama era, folks said we were in a post-racial society, but we are not in a post-racial society, and some of our current administration has helped lots of folks understand that. But this labor market in this country is segregated, and it's stratified by race and gender. So 87% of occupations in the US can be classified as racially segregated. The blacker an occupation is, the lower the wages are. For every additional $10,000 in wages, so as the wages go up, you see a 7% drop in the proportion of Black men in that occupation. These disparities show up in who can telework in this pandemic and who must report to duty despite the risk. Only 19.7% of Black workers can telework. An extremely relevant example of the segregation is Black and brown workers are more likely to work in lower paid frontline positions like cashiers in retail stores, while the white workers are more likely to be represented in management and supervisory roles. This pandemic has shined a light on the ways in which these workers have always worked the most dangerous jobs. For example, in 2018, the number of Black workers killed on the job increased by 16%. Now, frontline workers in grocery, transportation, food service, and other industries are deemed essential, and they are in danger of becoming infected, and some are dying of COVID-19. I want to call attention to these underpaid workers now being deemed essential. Cashiers are the largest number of at-risk workers, since that work puts them in direct contact with the public, and yet they receive the least protections and the lowest pay. We also see this in food processing plants, where Black workers are under or overrepresented. The same workers are also overrepresented in gig work through apps like Uber, Postmates, and Amazon Flex. And they are also at risk of contracting the virus. We know that they are excluded from workplaces that have protections and benefits like unemployment insurance, workers' compensation, and employer-sponsored health insurance. The coronavirus has shined a light on the fragility and inadequacy of worker health policies, and we have the opportunity to come together and ensure that all people have health care, paid leave, and paid sick leave, and economic security to guarantee their health and safety. Worker health is public health. We need to ensure that work protections like paid sick and paid leave are available to all workers. On the health and safety front, the Federal Occupational Safety and Health Administration, also known as OSHA, must enact temporary emergency standards to ensure that employers are providing the necessary equipment and training to protect healthcare workers in traditional settings, as well as other workers, home healthcare workers, school nurses, prison nurses, and more. In its absence, states must take action. I want to wrap this up on a hopeful note. In the midst of the coronavirus outbreak, workers like Fran are taking to social media to share their anxieties about a variety of workplace inequities that can worsen the crisis. They are standing up. They are standing up for lack of sick leave, lack of health insurance, and lack of safety standards. Workers and unions are organizing to demand more protection. With the Fight for 15 workers, domestic workers, nurses, flight attendants, they're all leading the way. And if there is a prime lesson in this crisis, it is that our interconnected lives depend on workplace protections for everyone. Luckily, we have the solutions to ensure that the most vulnerable individuals have better protections as workers so that families and our delicate human web can stay safe and healthy.
Thank you so much, Rebecca. And while we have you, there was one question that was lifted up early in the webinar that's asking, how do employers offer paid sick leave to hourly employees? Is it a certain amount of time per year or based on length of employment? And I thought maybe you could answer that question.
Sure, Kemi. I think the answer is that it varies. So some employers will give you a certain number of hours per year to use, and you can use them for a full day or a partial day. And some employers will provide you with just a whole bank of, well, PTO, which is all paid time off together. So your vacation and your sick leave together. So it really just depends on what they want to do, and there's no real distinction between hourly workers and salaried workers.
Thank you, Rebecca, and thank you again for illustrating through some of the statistics that you shared that really this pandemic has highlighted the ways in which workplaces are segregated, deliberately segregated, and some of the examples of who can telework. You know, Rebecca lifted up that only 19.7% of Black workers are able to telework, and that often due to occupational segregation, that folks who are in management supervisory roles tend to be non-Black, white managers. And the piece that I wanted to lift up is, again, what this pandemic has deeply illustrated is that worker health is public health. And I do think that there is an opportunity for all of us to be thinking about how health and safety can be elevated in this moment. And this is a part of the work that Jaribu has led for many years in the Mississippi Delta and across the state of Mississippi. But as we get through the rest of this conversation, that's something that I would love you know, speakers to talk about, that health and safety that we get to own and we get to redefine what that looks like. You know, dignity is safety, access to paid leave is safety, and being able to go to your work site and know that you can be healthy and, you know, safe from exposure is critical for safety as well. So thank you, Rebecca, for illustrating all of those pieces. And a couple of questions I'm seeing is that, yes, the webinar will be recorded, and we're recording, we're documenting all of the questions that folks are asking about additional resources. Some folks have lifted up how they can get involved with or learn more about occupational segregation, learn more about 5 for 15. So we'll make sure that in our follow-up materials that we're sharing some of those resources for you as well. And now I'm going to introduce our next speaker, Rickey Thompson, and Rickey Thompson is from Concerned Citizens for Justice. Rickey is currently a representative in the House of Representatives District 16 for Lee and Monroe counties. Rickey is also the former Justice Court judge, a community activist, a nurse CLPN, a married father of 4, and a grandfather to 2 grandchildren. And Rickey's going to share some of his experiences, again, being a frontline health worker during the pandemic. Rickey, thank you so much for being here.
Good evening. Thank you, Ms. Kemi, for that great introduction. I want to thank all the panelists for what they said. As Ms. Kemi said, we are with the Concerned Citizens for Justice, and the key issue that we want to be a voice for the powerless and encourage them for political and social empowerment. And that is what we do as Concerned Citizens for Justice. As a frontline worker, essential worker, as you would say, I'm a nurse that works at a home care term facility. And the things that I see and hear and understand from the rest of the workers is very important that when you have somebody on the front line that understands that there and you have your hand on the pulse, it's so very important that you listen and understand what's going on. Being there myself, I have seen the disparity when it comes to people of color. The thing that I really like to encourage everybody to pay attention when it comes to the front line, when they're saying things, pay close attention. As I interview for the job and sit down and talk for the orientation, and we talking about PPEs for the nurses and the other folks that work in healthcare, it's a very disparaging thing, because I asked a point person, I said, how often do you do PPEs for nurses and other healthcare workers? They said, well, you only get 1 mask. I said, okay, you only get one mask. What about the other days being contaminated, going into other rooms and still using that same mask day after day? Well, and this is supposed to be a well-known place to work at, but when it comes to PPE, we are just at the last of the list. And the thing I always tell everybody, it's a fear factor when you work in a place and understand that you're putting yourself at risk, you're putting your family members at risk, and you're putting your close person that you love at risk for the simple reason that you're not given the equipment that you need as a nurse and other healthcare workers. And talking to the other people that work in the system, and they express the same things to me. That's why it's so very important that when we work on the inside, we take information, gather information. So as a representative, I have been gathering information. So when it comes time to put, as they say, everything on the table, I have the correct information. And one thing that they expressed to me when it comes to PPE, that we are lacking that for as the long-term care facility, because when it comes to somebody that comes in positive, you don't have the necessary equipment. That means you're putting yourself at risk. So when you talk about the fear factor and you're talking about talking to other workers, the fear factor is number one. They're afraid to speak up for their job because they have to survive. And I understand that they have to survive and they won't say anything and come out front. So that means you have to have somebody that they feel comfortable talking to. And this is where the concerned citizens have made themselves in the community and been stable there to let them know there's somebody, because sometimes they don't know where to go. So that's so very important. And another thing that was just disparaging when it comes to a concerned citizen for justice and me being on the front line, talking to another healthcare worker, a husband was positive for the coronavirus. He passed away. Now, the thing about that is when she got ready to go back to her job, she was let go for the simple reason that she was positive and the husband, they didn't let her know. So this is something that we're working with. And like I said, it's always good to have a relationship with the Mississippi Workers for Center for Human Rights. And that's one thing that we want to make sure that when the worker comes to us, that we're able to provide the resources and connect them to the right people and be on the ground working. So it's very important that we understand that this webinar is so important, because as people of color, we are the first one and we are the essential workers. So we have to understand the importance of that. And I understand the importance of that as being a representative, concerned citizen, and advocate. So as we look through this pandemic, that the struggle is not over. The struggle has just begun for us. Where it hadn't begun, we always been in the struggle, I'll put it that way. So it's important that we understand that the importance of having webinars, understand that there are people out there that are concerned, will be advocates all the way. So as we do this, I want to make sure that in closing, that we understand that we have adequate PPEs for healthcare workers, for food processors, for fast food workers, for the grocery store workers and factory workers, because sometimes there are employers that want you to come back to work. They hadn't put anything in place, such as the hand sanitizer, the face mask. That's one thing that we got to look out for our workers, because we do have those employers that will not follow the CDC guidelines, and they got to have somebody that they can get the correct information for. So as a frontline essential worker, I understand, because I put myself at risk every day that I go into this long-term care facility, knowing that they don't have the adequate equipment, don't have the face mask, that we don't have the mask that we need to protect our own self. So there's a fear factor for me. Every day I go, that's a fear factor that I may bring something home to my family. And that's something that is very concerning to me, because here in Mississippi, we are the highest one for the death rate. And I have had several people that I'm real close to that have passed away. So this is a serious issue that we have to pay attention to. So let's not forget that we have to be on the front line to understand that we do need our PPEs for the healthcare workers and everybody that's involved in the community. And I'm so glad to be one of the panelists tonight. Thank you.
Rickey, thank you so much for sharing your words, and I'm deeply appreciative for you grounding us in the emotional impact of what it means to go to work every day with that fear, what it means to come back home with that fear, as we're all navigating our collective traumas, our individual and community traumas, as we're navigating loss and we're navigating grief. So creating space to honor that we're also grieving as we're moving through all of this, that we're also holding fear is very critical. So I'm grateful for you for naming that for us and sharing your experience. I think that there's also something that you said that was really powerful around documentation, that in some ways, this is also an opportunity for us to write and tell our stories, for us to document and write the impact and our experiences, but also the ways in which we're developing solutions as part of our response, but also as we are creating the vision for what a recovery will look like moving forward for workers. And one question that I had for you, you talked a lot about this dehumanizing dismissal of the CDC guidelines by many employers, not prioritizing adequate PPE for different categories of workers. And I'm curious, in your long-term care facilities, how have you all as workers been supporting each other? How have you been communicating with the families? Have families been advocates for you all? Have you been able to pull them into demanding PPE? I'm just curious as to what have been some of the strategies that you all have been using. And Rickey, you're still on mute. If you could unmute yourself again.
Okay, I'm unmuted now. Can you hear me? Okay, this is what we're doing now. I'm working with one of the ladies at work that's on the front line. We're in the process of organizing other individuals to come forward and just tell them what do we like and what do we need, because like I said, some of them are in fear for their job and they won't say anything. So we're in the process of doing that. We have corresponding about different letters, things that they need and things that they require to keep them safe.
Beautiful. Thank you, Rickey. And now I'm going to introduce our next speaker, who I'm a fangirl of, but they don't know that I'm a fan. But I'm so grateful that Nana Gyamfi from Baji is going to share with us about the work that they're doing right now in response to Corona. And Nana is an attorney and the executive director of Black Alliance for Just Immigration. She's previously worked as an adjunct professor at the Pan-African Studies Department of California State University, Los Angeles. She is also the founder of the Community Legal Clinic and Transformative Justice Center and Legal Ease workshops, as well as the co-founder of Justice Warriors for Black Lives. Nana, thank you so much for being here.
Thank you so much. I want to thank you, Kemi, for keeping us moving, but also pulling out those pieces because it's so much. I want to thank all of the folks who have spoken already and all of the panelists. Of course, love to the Mississippi Workers Center for Human Rights and to my sister Jaribu. Thank you so much for inviting me to be a part of this. Aaron, for making sure that we stay on track. Thank you to all of you for putting this on, and thanks to all of the people that have joined to participate and to converse with us about this really critical issue. I'm so pleased that you understand the importance of hearing from Black immigrants. I am the executive director of the Black Alliance for Just Immigration. We are a national organization. We are the largest Black immigrant organization in the country. We are a human rights and a racial justice organization representing the 10 million Black immigrants and refugees in this country, as well as advocating for our folks on both borders, both the northern and southern border of the United States. We educate, we advocate, we organize, and we push to build power with African Americans to fight for racial, social, and economic justice. This conversation that we're having about essential workers, which, we understand that workers are essential. We know that they're saying that with their tongue in cheek, that really what they're saying are expendable workers based upon the ways that we are being treated. And certainly Black immigrants are amongst those workers right next to our African American siblings. So I want to note and remind people that it is April 29th. And on April 29th, 1992, there was a rebellion that was started in Los Angeles that spread throughout this country, pushing back against the kinds of things that we're talking about in terms of our economic, our racial, our social position in this country. And so I'm hoping that we take that same energy of rebellion and that we root ourselves in that as we push forward on behalf of Black workers in this country. So looking at where we are and the work that we're doing, Black immigrants are amongst all of the essential workers that we've talked about today. So whether we're talking about healthcare, in which we have 700,000 Black immigrant healthcare workers in this country, 3 out of 10 Black immigrants working in this country are working in healthcare. And I think it's important, and I'm so glad, Brother Rickey, that you raised this, that we talk about where we are, because even in healthcare, there's a hierarchy and the class thing going on in terms of who's being shown and who's being seen as the heroes. And they're not talking about the home healthcare workers. They're not talking about the healthcare workers in nursing homes. They're not talking about the whole healthcare workers in clinics, in prisons, in detention centers, right? Who are not part of the correctional space and who often find themselves pushing back in support of our communities that are trapped and caged there and getting in trouble and retaliated against. And so when we talk about the breadth of healthcare workers, I always want to make sure that we lift up that full breadth. And Black immigrants are there, especially Caribbean immigrants. Any of you that have been to the hospital, or to the health clinic, if you don't come across a Jamaican, a Trini, Haitian, then you ain't been to a health place, right? That it's just that way. And they, again, are not getting the protective equipment that Brother Rickey talked about, but even a place to stay, so that, you know, these commercials that we see where people are looking through their doctor relatives through the glass while they are quarantined on the balcony outside, or that extra bedroom, that's not what we have. We are right there with our family members, generally intergenerationally, right? And so we cannot do the kind of social distancing even within our own households that they say that we need to do, and yet no one is giving us space. However, in LA, they've put LAPD officers, thousands of them, up in hotels. So they know how to do it, but they're just not doing it for us. And so I want to lift that up in terms of the breadth of what they could be doing beyond equipment, and what we should be fighting for. And then, of course, we have Black immigrants who are factory workers. And when we look at what's happening with Amazon, we have to lift up the Somalian women who are fighting. We're fighting before COVID-19 and continue to fight, older and younger, pushing back against Amazon. And so the face there is also a Black woman's face in terms of the resistance that we find, whether it be Amazon, whether it be Walmart, whether it be Whole Foods, whether it be Trader Joe's, we are there. And in these meat packing plants, when we look at what's happening in South Dakota, you will see, if you just peek under a little bit, how many Black immigrant and refugees have been forced to continue to work, sick, as Fran pointed out, and still having to get to work because they don't have the leave that they're supposed to have. And so we are pressing and pushing that we see Black migrants in all of the spaces. We are doing farm work in Georgia. We are doing farm work in Florida, and we are suffering there invisibly. And so it's important that we lift up the concerns of Black migrants and the Black migrant workers, and recognize that whether it's on the transportation with the MTA, healthcare, grocery store, a fast food worker, factory worker, farm worker, that Black migrants are there. And so we are doing our part to advocate on behalf of those migrants and on behalf of Black immigrants, as well as actually trying to help out with PPE, helping out with getting masks to folks. you know, helping for folks that have been laid off to become mask makers and to get some kind of stipend for that, that then those masks can go to those folks who are deemed essential and therefore exposed. And then we have this other category that we're also reaching out to assist. And that are the folks who have been laid off completely in LA County, which is where I am right now. 50% of LA County, which is one of the largest, if not the largest county in the country, 50% reported unemployment. And we know that means that it's higher than that. And we know that if there's unemployment, that we're going to be the people that have the highest numbers. And so again, looking at relief, how do we help folks out? How do we get cash in people's hands? How do we get food to people? And Baji is doing that. We have a national mutual aid fund. If folks want to hear more about that, how they can donate, how they can volunteer, we can share that link for that information. But we are distributing cash. We are helping people, some folks out with housing. We are helping with PPE. We are helping with food distribution. And we're doing as much as we can in the cities where we are. We're headquartered in New York, in Brooklyn, where COVID-19 is hit particularly hard with respect to the Black community and particularly the Caribbean community. But we're also in DC, in Miami, in Atlanta, in Los Angeles, in Oakland, and then we have staff in Minneapolis and Houston. So we have enough folks all over the place, and other Black folks that we're working with in Michigan, in Detroit and Kansas and other places that we're trying to get some sort of assistance to, because as was pointed out, based on the CARES Act and other state level relief, Black immigrants cannot get that relief. In fact, I'm sure some of you saw that if you are a US citizen and you're married to someone who is undocumented or doesn't have a social security number, and if you file jointly, you are not going to get your $1,200. That's how serious they are about making sure that immigrants don't get a dime and don't get a piece of peace and relief in this time period. And so we're also looking at folks who are undocumented, folks who are many undocumented Black people do not qualify for DACA because we are racially profiled as Black people. So we've got a ding, you know what I mean? We've been stopped by the police. We have some misdemeanors on our record. Driving with a suspended license in California is a misdemeanor. You get 3 of those, you're not DACA qualified, right? You have to have a certain job or a certain education. And because of anti-Blackness in this country, Black immigrants who are undocumented often don't fall into those categories. And again, there's no relief. Day laborers, domestic workers, the hair braiders, shout out to the hair braiders, right? Who are braiding hair out of their homes, who are doing informal work. All of those Black immigrants are left out. And so again, we're doing through our mutual aid assistance, but also working on advocacy. Our advocacy is broad. It covers those Black workers who are making pennies in the cages that we call prisons and jails and detention centers. And so we're pushing for those workers to be free, to be released, to be let out. Not some of them, but all of them. And led, of course, because of our commitment to working with African Americans for racial justice, led by the Black political prisoners, from Ruchell McGee, right? All of them should be out. They should be in the front of the line. You can't say free them all if you don't say free them all, right? And so we're pushing for that, as well as pushing for our folks who are in detention, who are often forgotten in that conversation, and who are often laborers against their will and by force. And then we are also pushing for the census, which I know sounds strange. When you say census in this conversation, people are like, what? There's a reason that they can point to, other than what we know about class and race, et cetera, that we don't have the resources. And part of it is our not being there, our not being counted. And we see what's happening now as a Katrina moment. You know, this is not something that's just going away tomorrow. We're gonna need resources in our community to take care of us past these initial waves. And the census is something that stays with us for the next 10 years. And so we're asking folks, as we're distributing, as we're helping, we're also giving census cards, we're doing census work, we're translating. We have now 8 different languages, from Haitian Creole, Wolof, Amharic, Somali, West African, French, Portuguese, Spanish, we're doing it all. And so if folks want information about our mutual aid fund, if folks want information about how they can connect with our census work, if folks want more data and research on the Black immigrant worker, please reach out to us at baji, BAJI.org. And I can also drop some of those links in the chat. Thank you so very much again.
Thank you, Nana. I can't help and sit here and just be like, this is the conversation we need to be having. This is the conversation that's really rooting us in something Rebecca always lift up around, like, root cause analyses. Like, what are the root causes of all of the issues that that have, come to bear and that have become even more visible in ways that we've always known are visible. So thank you so much, Nana, for what you lifted up. And I love that reframe of not LA riots, LA rebellion. So thank you for bringing that into our space. And just the erasure of immigrants, and particularly Black immigrants in this moment, is so systemic. And so I'm also grateful for you for rooting us in where these people are, where Black immigrants are, in what professions, where they are in terms of space. I think that the framing that you lifted up was really powerful around proximity. I got chills when you talked about what it means to social distance in an intergenerational household, and how do we hold space for that. So you're giving us the roadmap of how we think about our work differently, how we think about solutions differently, so that we're really centering again Blackness. And thank you for lifting up the impact of the census and the work that you all are doing around that. I know that the Mississippi Worker Center is also doing some deep work around the census, because in the ways in which folks are using mutual aid strategies, that it's also important to be thinking about how are we using strategies within the systems that exist to ensure that, again, as we're thinking about recovery, we're ensuring that we are primed to get as many resources to our communities as possible. So thank you again for naming that. And shout out to Lifting Up of Dawood, which is the worker organizing center in Minneapolis. They've been doing such incredible organizing around Amazon. And one question that I have for you, because I think it's really important how we talk, how we ensure, and it's been made more visible, of how incarcerated and detained folks are workers. Like, they are producing the goods for government. They are producing the goods that we're taking in without even realizing. And so I'm just curious if you could talk a little bit more about how you all have been working to visibilize the work that is being done by incarcerated and detained folks.
Thank you for this opportunity. I mean, I think it's been made so much easier to do by the fact that we have 44 and a half and his minions, and the way that they've done policy. So, for example, in Alabama, when the U.S. government had passed, had pushed these immigration laws, and folks were afraid to come to the fields, right? So undocumented workers, including Black undocumented workers, were afraid to come to the field. The governor of Alabama said, oh, don't worry, we got prisoners to do that. So it's all right. You know what I mean? It's okay. We have another way that we can handle this. And same with the wall. The governor of Texas said, oh, that's cool. The unions won't go for it. Okay, that's all right. We got people in prison, right? And so there's this idea, they in their own minds connect up folks in detention who they have doing work on farms and doing work inside detention, folks in prison, and these undocumented and sort of under the table workers. They've made that connection and they find those pieces, quote unquote, right, on their chessboard to be interchangeable. And so I think that, you know, with Baji, our effort is to always make those connections, to make sure that we understand that the fight for racial justice in this country and the discussion about work, as our esteemed sister Jaribu talked about, is rooted in chattel enslavement. And so you can't talk about what's happening with immigration in detention centers without talking about what's happening in prisons, and therefore not talk about what's happened as sharecroppers that didn't get any of the crops, as you pointed out, Jaribu, and then also chattel, you know, folks that were enslaved. You can't not have those conversations together. And so we lift that up at every chance that we can, to make sure that we have those connections, because often Black immigrants don't have those connections. I mean, they're not learning about that in school. We barely learning about it over here, you know? And so you've got to make those connections for folks.
Thank you. That just so deeply powerful. And I think, again, all of what folks are sharing provides such critical templates of how we all need to be thinking about our work differently, or deepening how we're thinking about our work as we move through this pandemic and recession, in order to make sure that our work is building on all of those connections as well. And I just want to, again, express my gratitude for the fact that you also lifted up health workers in prisons, health workers in detention centers, so that they're not erased in this moment in the breadth of healthcare. Shout out to the African and Caribbean diaspora, and also just the way you beautifully threaded how over-policing of Black communities shapes how Black immigrants are able to access DACA. So the connections are there by design. All of these systems that are anti-Black are reinforcing each other. So thank you for helping remind us and root us in that. How are folks doing? This is such a deep, powerful conversation. Do we need like a stretch, or like, you know, maybe?
Great.
So take a minute to just take a stretch, you know, let all of the wisdom and the testimony run through you. If you need to run and get some water, we can't see you anyway, so that's okay. And just again, grateful to all of the panelists and speakers for all that you're sharing, and also just for allowing us to bear witness to each other. This is such a beautiful opportunity to have this conversation. Again, I want to remind the attendees that we are recording this webinar. We will be sending it out, and we'll also be sharing more information and resources. Some folks have lifted up how can they be working more closely with the Mississippi Workers Center in Baji, so we'll be sure to share some of that information as well. And I'm excited to introduce our next speakers. And my apologies, I realize I don't have a bio for you, Linda, so I hope that you take a moment to lift up and share with us about your experience and what brings you to this conversation. And so Linda Walton and Aimée-Josiane from the National Domestic Workers Alliance are gonna share with us a little bit more about their work. Aimée is the Director of Black Organizing at the National Domestic Workers Alliance. Aimée is a queer Black Rwandan immigrant currently living in Atlanta. They are a former childcare worker and union worker who currently leads the Black Organizing program for the National Domestic Workers Alliance. Thank you both for being here.
Thank you for having us. Thank you. Thank you for having us. And just, you know, want to echo everything that all the panelists have shared. This is very, very powerful to witness and be a part of. So Linda and myself are part of the We Dream in Black program of the National Domestic Workers Alliance, which is a political home for Black domestic workers across the country. So we have domestic workers that we support and organize with in multiple states. And the workforces that we know are domestic workers are people who are nannies, and childcare workers, people who are house cleaners, people who are CNAs, home care workers, and other health aides. And so, with the National Domestic Workers Alliance, we believe that our organizing has to be led by and also center Black women, because Black women is who this industry was designed to exploit. And we see that with the birth of this industry through chattel slavery and a slave economy. And so those same conditions, still persist today. Like we see that domestic workers across the board are paid about $11 an hour. The workplaces that we have are often private, isolated, unregulated, and it's almost impossible to have adequate wages in addition to health benefits and other things that just help us have full lives. And so I wanted to pass it over to my colleague Linda so that she can introduce herself and tell us a little bit about what she's seeing right now.
Thank you. I'm Linda Walton, and I've been in healthcare for over 10 years, but I've worked in the capacity as a CNA now for 3 years, inspired by caregiving of my grandmother, who helped raise me back in Alabama. I'm here in Atlanta now. This is my second home. But I wanted to talk to you all about my experiences with working as a CNA home health care provider here in Atlanta in the setting of home health care. And when we got the information about the COVID-19 virus, our company was very, very quiet about it. It was business as usual. Even with the other caregivers, we weren't providing any type of PPE protection. However, the home that I work in, the gentleman that I care for, he provides hand sanitizer and gloves. We wash our hands. I mean, that's like a common thing for healthcare workers is the hand washing thing. Hand hygiene is stressed often. So, a couple of coworkers, I mentioned, I was like, have you all heard anything about us getting any type of PPE? And they were like, no one was wearing the mask. We got CDC guidelines passed down maybe 2 to 3 weeks into, the epidemic, and our agency finally reached out to us, and they were saying, these are the CDC guidelines. Have you all had any of the symptoms of the COVID virus? And that was pretty much it. And then all of a sudden, they started to reach out to us when they were getting personal calls from families wanting us to provide care for COVID positive patients. So once that happened, they offered the PPE if we decided to take a case working with a COVID positive patient. However, we weren't offered any type of hazardous pay or any, formal training. It was like a text went out and they were like, you can take the gig if you want to. And later on, down the line, they decided to do town hall meetings on Friday, and it's volunteer. I mean, if you want to attend those meetings, you could attend them via the phone. And I felt like we were getting kind of mixed information, in regards to what was being put out by the CDC versus what we were being told by some of the head nurses in the company. We still weren't being offered any type of protect PPE. We were told that hand washing was considered a PPE. And I thought it was a little unusual. And then later on, we started getting texts saying, hey, we need you guys, if you want to, would you volunteer to go into some of the hospitals or other facilities that they really need help? So, it wasn't mandatory, but it was offered to us. However, I felt like, the lack of them, educating us about it from the beginning, and the lack of PPE, I felt that it was really risky, because we're not provided health insurance through the company. As you know, the wages aren't great working as a CNA. But, I just found that the whole situation was a little bit, only when it was convenient for them, they reached out to us to offer any type of support or education about the whole COVID pandemic.
And if I may also follow that up in saying that, Ms. Linda works in home care, but we're hearing the same things for people who are nannies, still working, people who are house cleaners, still working and interacting with clients. And there isn't enough attention being paid to the fact that, workers are going into people's homes, they're caring to people who themselves are sick or may have family members who are sick, and are always at risk of bringing that virus back home. And I think that that's something that, Fran and some of the other people have mentioned, is having to move and go back and forth to work can be disastrous, especially when we're working in an industry where if you don't go to work, you're not going to get paid, and that's exactly the relationship that exists there. And so, just want to lift that up, and also share that the most devastating stories that we've heard so far, Linda and myself were on a call with some of our sisters from across the country earlier this week, and people were saying they were talking about people that they lost, and how it brings back the pain that we see in this industry, where domestic workers historically and currently are dying on the job, because those are the conditions and there isn't access to some of these other life-saving resources.
Linda, was there something else that you had planned to lift up?
Oh, yes. I just wanted to say that, as a member of We Dream in Black, I'm a part of a group where we have spaces where we share resources with each other. And we also do, we have like group chat. We also have, we make phone calls to let people in Georgia know what resources are available. And we support each other, which is very important during this time, in the pandemic. Because like I said, when you're working in other people's homes or working through agencies, sometimes it gets a little lonely, and, having that support system is very, very important for domestic workers.
Thank you, Linda. Aimée, was there anything else that you had wanted to lift up?
Sure. The last thing I'll say is that we have also launched a care fund for domestic workers, where we're giving just a one-time cash assistance to anybody who's a domestic worker and needs the support to stay home or to get to work, by following safety standards. And so, like many of the panelists before me, I'll make sure that that information is shared here and after this panel as well.
Thank you both so much for sharing all the work that you all are doing, and Linda for again grounding us in the specificity and the picture of what you are navigating in the day-to-day. And I think that as you were sharing your story, a couple of things that stood out at me is, one thing that many of us have been saying, we've definitely been lifting this up at NELP, is that unless CDC and OSHA are mandating and enforcing these guidelines, employers are not picking them up voluntarily. And you illustrated that it's not happening. And that, the it's not mandatory, but it's an offer, is so deeply coercive. It's just so violent because it's their, you know, they're leveraging their power, and they're leveraging that, you know, you can only have access to protect yourself if you put yourself in further danger. And so just thank you for reminding us of the truth of, like, that's literally what's happening in the day-to-day, that there are employers who are not valuing our lives, and that there are employers who not only are they not valuing our lives, they want us to shoulder the burden in caring for others. And, you know, the other thing that I think about as you were sharing your story is that, again, prevention is not prioritized, but that there's also, this pandemic has also lifted up how much employers have been exploiting people's ability to move or to not move. And again, just thank you so much for rooting us in the specificity and the reality of what it is day to day. And you started to talk about some of the ways in which you all are providing care for each other. And I would love for you to talk a little bit more about that. It makes me think of, there's a great Adrienne Marie Brown quote where she says, small is good, small is all. And I just feel like how we care for each other in the small is actually what's also super critical for our sustenance and our recovery. So I'd love for you to share more of that.
Yes, we have members call and check on each other. Like I said, we have a group chat. We have information resources. We communicate through our group chat. We also, you know, have our Zoom meetings like we have now. There's so many great things. We're just there for each other. We're like a family, sisterhood. And that's so important during these times. We need to know that we have other people there to support us. We have fun, you know. There are meetings, Zoom fun events. Everything is Zoom now, and we're really utilizing that with We Dream of Black in Atlanta. And some of the other organizations, they also invite us. I was on a call with Philadelphia maybe like a week ago, so we get text. So that keeps you grounded, and that keeps you, you know, feeling like, okay, I'm not in this thing alone. I'm not isolated. I'm not in this battle by myself, and that there are other people who care. So that's so important, and that means a lot to me.
Thank you. So I'm going to introduce our next speaker, Jayanni Webster. And Jayanni is a Southern-based organizer with 10 plus years experience in labor, community, and student organizing. She's organized fast food, home care, and campus-based workers for the past 6 years. Welcome, Jayanni. Thanks so much for being here.
Thank you for having me. It's an honor to be with y'all tonight and hear all of these incredibly powerful and courageous stories, and all the amazing work that's being done to protect our people and to fight back. So I live in Memphis. It's a majority Black city, but where working class Black people don't have economic power. There are some Black elites that have political power, but the real people who run this city is not the government, it's business. So up until a few years ago, even our Chamber of Commerce advertised exploitation of Black people as an incentive for business to move here. So on the website, low wages was advertised as a reason why businesses should move to Memphis. And most low wage workers in Memphis, an overwhelming majority are Black. Secondly, Memphis is a warehouse town. All the big names, Williams-Sonoma, Nike, Technicolor. A lot of people don't know that the headquarters of FedEx is here. It employs thousands and thousands, tens of thousands of people in the city. So in an environment like this, where there's already a crisis amongst Black workers, where we're in a right to work state, a fire at will state, this pandemic is exacerbating what Black workers are facing. Incredibly difficult enslaved-like conditions, from the service industry to the warehouse industry. And so disproportionately, Black workers are being relegated to what we are now calling critical industries, and they're being labeled, as folks have already said, as essential workers, but their lives are not being treated as essential. They're not seen as essential people. So I want to talk a little bit about if there are folks on the call tonight who are trying to figure out, how do I organize in my workplace? What do I do? Or how do I give advice to a cousin who works in fast food, or a sister who works in home care like my sister does? And so, Linda, your words really touched me. I want to talk a little bit about what's possible and what workers have been doing for a really long time, and what you can do when you and your coworkers come together. So if our labor is essential, that means that we have power. Collectively, collective action has the power to win. In a non-union environment in which most Black workers are in, you have to involve your coworkers and the community. So if you work for a non-union employer, in the private sector specifically, you do have access to a protection that's called concerted activity under the National Labor Relations Act. So what is concerted activity? Concerted activity is when 2 or more employees want to address their employer, and they take action to improve their conditions, such as pay or safety concerns. So everything that we're hearing tonight around the COVID-19 pandemic. But it always has to be 2 or more, otherwise it's not protected under that law. Most employees in the private sector are covered under the NLRA, but there are some specific exclusions, like domestic workers and government workers, and I'll post a list of exclusions in the chat. But for other folks, what's really important is that concerted activity is not something that is a blanket. It doesn't protect you from being fired or adverse action, but you may still be able to file an unfair labor charge to try to hold your employer accountable if you and your coworkers just decide to send an email to say we need PPE, or sit down in a staff meeting and say, we're not going to go back to work until you provide some safety measures. So, which brings me to another important point. I think it was Kemi who talked about documenting our stories. Well, when you're engaged in a fight back at work or collective activity at work, it's really important that you document that too. Document everything, every activity that you do. Put your demands in an email so that you can prove that your employer knew that you were organizing, and you can be backed up by the law because of that. Oftentimes employers do this kind of shady stuff where they're just like, oh, you came in late, 5 minutes late last week. And we're gonna let you go. When really it's because you've been organizing for the past 5 weeks with your coworkers. But if you have documentation to show that the employer had knowledge of this organizing, then you could possibly be able to file an unfair labor charge and get some level of recourse. Outside of concerted activity, still band together with your coworkers. It's more of you than it is of them. As Fran reminded us, it's more workers than there are CEOs. And we've seen incredible wildcat strikes. And these are strikes that aren't necessarily authorized by the union itself, but workers have decided they're going to take collective action on their own and walk out or do a sick out and just call in and all these other different ways. So you're stronger in numbers. And then there's OSHA. Which I think Nana talked about a bit, and some other folks, is so workers do have a small right to refuse dangerous work under OSHA. If you believe your working conditions are unsafe or unhealthful, you have to bring that to your employer's attention first. However, you can't outright refuse. So you have to ask your employer to correct the hazard, or to assign you to other work. And then you have to stay on the job until they dismiss you. Once that happens, you have a right under OSHA to file a complaint. So these are some like small ways in which the law provides a little bit of an opening in order to kind of push back against the employer's tactics to try to divide and isolate you all. But the biggest thing for Black workers today is sticking together and being able to confront their employer, you know, at the same time with the same method. And so talk to your coworkers, get the community to back you up, clergy, excuse me, local elected officials. All of that is a part of kind of building our power in the face of incredibly difficult conditions. And so that's all I was hoping to say tonight. And I can provide some resources in the chat and appreciate everything that folks have said.
Jayanni, thank you so much for sharing what you did and for actually walking through some critical specific ways in which folks can continue to be building power and doing worker organizing in their settings and with their communities. One question that I have for you, and I was curious if you have seen folks discuss this or any resources around for some of the states that are accelerating towards reopening. There is some concern that part of that is a tactic to get folks off, to get businesses and individuals off the UI rolls. And so, you know, I can't, I apologize which state, I think it was the governor that just, you know, made an explicit statement that if you refuse to go into work because, you know, perceived danger or perceived health and safety issues, in a situation where, you know, they've now reopened, the business can open, that it's called like a voluntary quit. Or so I'm just curious if you can talk a little bit about that and sort of what are folks thinking strategies around how to address that very real issue that you know, our peers in the particularly in the southern states that are reopening are going to be facing.
Yeah, thanks for the question. I mean, it's a very difficult situation for people to be in, especially if they're in industries where they weren't necessarily connected to their coworkers. So they may not know who is in such a position where they're gonna go in or not. You know, right now, I think the tough thing in unorganized environments or workplaces is that you have people who may have a little bit of safety net. So they're just like, I'm just not going back in. I'm done with this job. And there's some people just like, I have to go back in. So I think the first thing that I would encourage folks to do is try to get the contact information of the people that you work with. Call them or drop a letter off at their door. Do what you can to try to contact them and to say, hey, how do you feel about our employer requiring us to come back in? And do you think we can do something together to make sure that if we all need to return, that we say these are our demands for returning, so that they can't say, well, oh, okay, 2 people can't return, we're gonna take them off the rolls and these other people will come in. So I think the best thing to do is try to contact your coworkers. In the face of that, you can start contacting your local community organizations or labor unions that might be working on these issues and ask for support. There's usually a local organizer who can offer some type of advice to unorganized workers around what to do in these situations. But it's an old, but it's like a newer tactic right now in this environment to kind of force working people against the wall and to try to continue to isolate them. So connection is our best defense. And if there's no ability to connect with your coworkers, I would reach out to a labor union or a worker center or community organization that can put some type of spotlight on this employer as a way to put public pressure on the type of tactics that they're using.
Thank you so much. And connection is our best defense. Like, that's just beautiful. Thank you for that word. And I know that you'll have to jump off a little bit early. So we'll say goodbye to you and thank you so much for all that you shared and the resources that you've left us with. So I'm so excited to introduce our next speaker, LaToya Lewis. And oops, sorry, I hadn't pulled up your bio yet. And Toya Lewis is a proud New Orleans native who experienced and survived Hurricane Katrina during the first week of her senior year of high school. In 2011, Toya became a member and then an organizer with Stand with Dignity at the New Orleans Worker Center for Racial Justice, where she organizes a grassroots membership base of underemployed and unemployed Black workers ready to build a powerful movement that results in dignity, equity, and inclusion in the New Orleans economy. Toya is currently leading Stand with Dignity in moving the NOLA Shakedown campaign, which is geared towards ending the cycle of poverty and exclusion that people are trapped in as a result of fines, fees, and warrants issued by the municipal and traffic court. Welcome, Toya.
Hey, y'all. Thank y'all for having me. And I feel in deep solidarity to everybody, solidarity with everybody who spoke before me. I'm very grateful to be on this panel. Yes, I live in New Orleans, and what we've seen in New Orleans was that right after Mardi Gras, there's a large number of COVID-19 cases that hit in the city of New Orleans. And personally, that made me have some feelings about Mardi Gras, which is a event that I haven't celebrated in about 15 years myself. This incident just began to remind me that we know this place. And we know this place is a poem that a local poet named Sonny Patterson wrote a long time ago, like right after Katrina. She reminded us that we know this place, and her poem reminds me of how Mama Jaribu spoke earlier, that what's happening now has a direct relationship to chattel slavery. It has a direct relationship to everything we suffered before there was a COVID-19 or Rona. We knew that during Hurricane Katrina, there was a deep, it was deeply man-made, and it wasn't just a natural disaster. It was a deep level of racialized capitalism that influenced the time and influenced the harm and the issues that people face. Those in power, we know that those in power will continue to blame this viral microorganism instead of blaming themselves from prioritizing big business over poor people and the people that need help and support the most in this time. We learned a lot during Hurricane Katrina that we could use in this time. We know what our people in power will prioritize, and we need to pay attention to that. We know that whatever disaster comes, some reason to do some urban development that locks us out of housing, that locks us into the criminal justice system, and locks us out of access to good jobs. When we think about the essential workers that's doing work in this time, a large majority, as many people already mentioned, a large majority of those workers are Black workers. And what I see when I go out and get my essential needs taken care of is a lot of young Black women taking care of me. And I know that those young Black women have family members that they take care of. And so they're going home and they have to protect themselves while they're on the street, and they're taking a risk. And that risk is not just theirs, that risk is for their family and the people who they live with and care for. These people are hospitality workers who work in grocery stores, they're caregivers, like people named already on the call. And we also looking at the fact that Black people hold over 70% of the COVID-19 cases across the country. And when I hear them talk about this in the media, I hear them say that all Black people need to do is just stay inside. In New Orleans, that's an excuse to criminalize Black people for being on the street. But across the country, the narrative is problematic because it ignores the historical systematic racism that comes with the reason why that number is so large for Black people right now. We're not having that conversation yet. And it's harmful to know that they'll pretend to act like they'll try and find the issue and try and fix this. But I don't think that our system is prepared to go into the history as to why Black people are leading in the numbers right now. Right now in the city of New Orleans, the mayor of New Orleans issued police order to have police checkpoints. And these checkpoints are supposed to, at these checkpoints, the police are supposed to make sure that people are going out for essential needs only and are informed about how to take care of themselves during the pandemic. Now, this is extremely problematic because it forces people to be interacting with police officers who a large majority of them are not wearing gloves or masks at this time. And we already know when law and order like this is issued, it discriminates against people of color, right? So, and that brings me to the work that we're doing right now in New Orleans and the NOLA Shakedown campaign, where we're trying to shake down the system instead of allowing it to shake down us as it's done for many years. And if most people that know, if y'all part of the New Orleans, the shakedown is something we do down here with bounce music. It's a generational thing, but with bounce music and all that. The NOLA Shakedown is an abolitionist-inspired fines and fees campaign geared towards ending the cycle of poverty that poor people are faced. And specifically, we're working in the municipal and traffic court systems right now. And so far, we've organized 2 warrant clinics where over 2,000 people came to those warrant clinics, received fines and fee reductions, and warrants wiped off their records, and was able to get driver's license reinstatements and things of that nature, so that they can go out and get their driver's license and be able to find jobs and continue their life after being trapped in poverty for such a long time. And so, like, we continue to move this campaign even before we were sheltered in place. And just before we were sheltered in place, there was a number of people who we've done walkbacks to court with who got cleared up. But the next step after getting cleared up is to go to the DMV so you could get your driver's license. And a large majority of people haven't been to the DMV, and the DMV closed right now. So at these checkpoints, the question is, what happens to them? You know, do the police care that they took care of that issue and they'll get their driver's license as soon as the DMV opens, but they just got to take care of this essential need? Probably not. And that continue to do the work to fill up the prison, while there's a number of young, amazing Black organizers in the city right now that's doing a lot of work to do the opposite of that. So that leads me to talking about one thing I'm really proud of in New Orleans is the work that's being done and how that's shifted a large majority of the decision makers in the city. I'm thinking about the work that the Orleans Parish Prison Reform Coalition is doing, and moving the sheriff and emptying out the local jail here in New Orleans, and moving the sheriff to actually join them in an effort to move this criminal district court judges to support in that effort right now. And the work and the demands that the folks that's working behind Eyes on Surveillance is doing to demand that the checkpoints don't happen, and demand that they don't use these surveillance cameras to criminalize poor people. And, you know, we have a lot of good decriminalization work moving in the city of New Orleans that is changing a lot of policymakers' minds. And we've educated a lot of policymakers on what decriminalizing New Orleans could look like. We just got to do work on our mayor, who feel like law and order is something that's important in this time. So thank y'all.
Thank you, Toya. Again, thank you so much for giving us a picture of what's happening, and also the different ways and different domains that are influencing and shaping what our pandemic response could look like. And I think that, you know, one thing that you really lift up, one, is that so many people have said it more eloquently than I can, is that abolition is really what is rooting us and holding us and lifting us up in this moment. Because so much of what abolitionists and abolitionist organizing has visioned as possible, we're seeing today. And so just again, thank you for grounding that your theory of change is really grounded in abolition. I'm also struck by what you said, that we know this place, and that there's also, even as we're talking about our collective experience, the collective experiences of Black folk, there is also specificity and regionality. We're not a monolith around how Black communities across the country are going to be experiencing both, again, the impacts of the pandemic and also the recovery. So for us to be really mindful of that as we're thinking through what solutions and recovery looks like. And then just thank you for sharing with us some examples. And I think, Fran, you've done this, Linda, you've done this, of how part of the reason why we're having success in this moment is because of all of the worker organizing and worker power building that has been happening over a variety of issues for so many years. And so I think someone in the comments said, let's make sure that we're lifting up our lessons and we're lifting up practices, right? So that part of what we're thinking about in terms of this response is like, what can we learn from the work that you all are doing from fines and fees? What can we learn from the work that Baji has been doing with Black immigrants, and particularly lifting up the work that you all have done around addressing issues of surveillance and addressing issues of exploitation with immigrant communities, which I think is going to be really critical moving forward. So thank you so much, Toya. And last but not least, our last speaker is Aaron Greene. And Aaron is from Resist the Rona. He's a co-founder and webinar producer today. So again, thank you so much, Aaron, for pulling us all together for this really powerful space that we've been sharing for the last 2 hours. Aaron is a South Carolina native, is an associate counsel at the New Jersey Institute for Social Justice. Aaron serves as a coordinator for the Right to Vote movement, an initiative that was created by incarcerated people following the 2018 National Prison Strike, which began in South Carolina after the Lee County Massacre in April of 2018. Thank you so much, Aaron.
Thank you so much, Kemi. And I want to thank all of our panelists. It's been very powerful just being in this space, just taking it all in. I'm definitely going to rewatch this when we get the video published. I want to thank everybody that's tuned in as well. So I'm going to be showing some visuals during my my presentation that will center on the root causes of when we look at capitalism and how it's guaranteed. And when we look in America, it's guaranteed through slavery, exploitation. When I think about Harriet Tubman, Sojourner Truth, Nat Turner, DeMar Vesey, some of the ancestors that were abolitionists, they pushed for abolition of slavery. But I think about also they pushed for abolition of every cent of slavery. And we still have those elements of slavery still here. Paige, if you can pull up the PowerPoint, thank you. Go to the next slide. So I want to first highlight what is happening in prisons across this country. It is a pandemic. It is a ground zero. It is a disaster. We have 200 reported deaths, over 15,000 reported cases. Now I want to highlight this. These are just the reported cases. There are a lot more cases that are present in prisons in New Jersey, where I am currently located. We have over 154 people in prison that have tested positive for COVID. 29 people have died in prison in New Jersey. In Michigan, you have over 30 people that have died in prison. In Alabama, you only have reported 4 people positive. There are over 30,000 people in the prisons in Alabama. They are not testing people in prison at a sufficient rate, but also more importantly, they are not seeing people in prison, our system governments, as human beings. In New Jersey, we recently had to fight for the government to test youth in prisons. We're the first state to implement that. That's not good news. All other states are not testing youth that are in prison. So this is an important issue that has to be lifted on all fronts. Paige, if you can go to the next slide. Thank you. The 13th Amendment, we have to push that, right? We have to lift that up because that shows us what is happening in America, is that they did not end slavery. They did not end slavery for those that are incarcerated. So when we see people working currently now during COVID, we are seeing slavery. When you saw people on the highway picking up trash and incarcerated, you were seeing slavery. We are seeing slavery all across this nation currently, and they're not given the proper protections, the health care that is needed. They should be released at rapid numbers. And that is not happening in our country. Paige, if you can go to the next slide. Thank you. I want to highlight this. These are the hands of an incarcerated woman in South Carolina where they are being forced to make masks. They're producing thousands of masks each day. They are not being compensated. Brian Sterling, the South Carolina Department of Corrections director, said that there is a volunteer program. Now, he got mad at me when I exposed this, and I said he sounded like a slave master when he said we are making 4,000 masks. No, incarcerated women are making masks for free, right? So you shouldn't be mad. You shouldn't be mad at me for implementing a system like this that continues slavery. This is happening in South Carolina. Paige, if you can go to the next slide, another picture. In South Carolina, another picture of what is happening. They are selling this as a volunteer program. Now, we know better than that. We know that this are capitalistic agreements that are happening to protect people on the outside, but what is being done for the people that are making it? They're not being protected. Thank you, Paige. Now I'm going to highlight New York because there has been a lot of push in regards to Andrew Cuomo. People have been praising him. People have been saying the next president. Well, I want to show you what is going on in the prisons in New York so people can see what is really happening to the most vulnerable. These are incarcerated people that he is forcing to make hand sanitizer. Hundreds of thousands of gallons per week. They're making hand sanitizer. Last time I checked, this hand sanitizer they can't even use. Maybe it was changed recently, but initially they couldn't even use the hand sanitizer that they were making for the government in New York. This is Andrew Cuomo posing with the hand sanitizer, bragging about using incarcerated labor to make hand sanitizer during the pandemic. I just want you to look at that picture and the way he is selling that to the community. That is improper, that is slavery, that you are forcing people, mostly Black and brown people, to labor, and you're not offering protections when they are dying, as we've seen people that have died in Rikers and in prisons all across New York City, New York State. And they're making 62 cents per hour. These are incarcerated people in New York that are burying COVID victims, $6 per hour. These are, as you can see in the picture, you see them in the graves while the correctional officers, probably with their guns, are looking upon them. That is slavery, what we're seeing, $6 per hour, burying people. This is in Texas. There's another Brian Corlier. We have Brian Sterling, who's oppressing people in South Carolina. We have a Brian Corlier in Texas who's oppressing people. He said, we want to use cotton. We want them to use cotton to make 20,000 masks per day like they are on a slave plantation. And that is what's happening. You see a picture of how it's set up and how they're working day by day. These are hours and hours that they're spending on the front lines producing these masks that they can't even use for themselves. Unicor. Unicor is a federal government entity, industrial industry. This is a cotton mask. This cotton mask is produced by people that are incarcerated. They also are producing surgical masks. Now, I put this mask on here because people incarcerated in federal prison can only get the cotton mask. They can't get the surgical mask. The surgical mask is given to the staff. Now, they are paid 23 cents to $1 per hour. This is a federal program that has been pushed. This federal entity, Unicor, has a gross income of $500 million using labor at 23 cents per hour. This is what's going on where they're producing thousands of masks each week. want to highlight this. This is what I found from an organizer in Alabama. This is a consent form that has been provided to all people incarcerated in Alabama. They have to sign a consent form before getting a mask. Now, I want to highlight again what I said earlier. They're only reporting that 4 people have COVID in Alabama when there are over 30,000 people incarcerated, and over majority of them are Black people. They have to sign a consent form before they are able to receive a mask. And the consent form relieves the Department of Corrections of any liability, So that is what's going on in Alabama. Please, you go to the next slide. Thank you.
That's the last one.
Okay, that's the last slide. So I want to lift up a few more things. In Michigan, where it is ground zero for people that are incarcerated, currently at the most deaths, I believe over 34, 35. People incarcerated are working as janitors. Their hours have increased to 10 hours per day. They're paid $40 per month. They have asked for a $2 hazard pay raise. They were denied this. And I know in here we have Amani Sorori who's organizing on this. Amani, please share your contact information so people can get connected with you and help you as you all are fighting for truth in sentencing laws, reductions and reforms in Michigan. And I know that you're doing health kits where you're providing for people that are incarcerated in Michigan. There are a couple more things that I wanted to highlight. Well, let me just put this down. I think that I've looked at my notes long enough. I'm gonna wrap it up. But we have this is a disaster what's going on in our prisons. Our government, state governments are not taking this serious. I have not seen any massive action from state entities. So it's very important that we as organizers, as advocates in this space, we continue to push. We continue to fight. We continue to stand in solidarity with those that are incarcerated. If we have family members, if we have friends, if we have people that we know that are behind the walls, let's connect with them. That's what we're doing with all of us are none in New Jersey. We're connecting with people incarcerated. We're amplifying their voices. We're pushing for changes to be made because we have to save these lives. Every prison in America is in violation of international law. The United States Charter and the Nelson Mandela rules say that every person incarcerated should be given public health care as those on the outside. That is not happening. That is not happening in our prison. I want us to think about that. What is happening to people that are incarcerated when someone gets it? Do they have ventilators? Do they have people responding to them? That is not happening. We have a person in New Jersey who shared with me. He said he had 12 people that were currently on ICU right now from a prison in New Jersey. So this is something that we have to get involved with. I know that Resist Rona, we're going to be doing co-sponsoring a webinar centered on people incarcerated. We're going to bring organizers from New York, organizers from New Jersey, organizers from Alabama, organizers from South Carolina, organizers from Michigan, all together so we can bring this collective voice and push it forward, because we have to fight for our people. If we do not, this will only get worse. Like I said, in New Jersey, we have 159 positive cases, 29 deaths. Think about that ratio. Think about that ratio. That is horrific. And that's just in Michigan. And I mean, it's just in New Jersey. And all of these things are happening across this nation. So we have to fight not only for people on the outside, but we have to fight for those that are constrained to this slavery that continues. So we have to fight to break every single chain that still remains on this soil. We have to fight not only for the current, but also our ancestors who pushed for this abolition of slavery. We have to abolish these systems and help free our people from these conditions and this imprisonment. Thank you so much.
Aaron, thank you so much for your words and for that testimony, and particularly those images to remind us of who it is that we're talking about. So I'm just so grateful that you brought the hands. That was just such a deeply powerful image into this space as well. And I mean, you shared so much that was so rich. And I think some of the things that really stuck out to me that we can be thinking about again as we're thinking about our recovery response is that there is such deep exploitation that's already embedded into the jail and prison system, and that we have to expect that that exploitation is going to continue in this pandemic and in the recession. And so how are we thinking of ways of disrupting the exploitation of the labor and the work of those who are detained and incarcerated as part of our worker power building, as part of our worker movements? Because what happens to folks who are incarcerated and detained will shape the experiences of low-wage workers in some of the frontline industries that we've been talking about. In fact, it'll impact all workers. So thank you for lifting that piece up. I think you also, Nana, left a comment that there are intersections about some of the things that are happening in detention, in jails, the use of consent forms, the use of essentially coercion that removes liability. And we're also seeing that in some employer cases. So that's also something that we want to ensure that we're being mindful of and thinking through in our strategy responses. And then there is no volunteering in prison. I mean, it's exploitation in every possible way. So again, thank you for grounding us in the clarity of that piece. And we have a few questions that I wanted to lift up and ask for some of our speakers to answer before we pivot to Jaribu for a closing. And one of the questions was, what do you need for a just recovery? And I welcome any of our speakers to answer that question. What do you need specifically in your work? What do we need as a movement? What do Black people need for a just recovery?
I can just say one word: end capitalism. End capitalism.
For me, I would honestly have to say that people have to realize that we're human first. We're not these world machines. I put my clothes on like everybody else, and I demand the same rights as everybody else, because we are all human and we are all equal.
Yeah, to piggyback off Fran, yes, recognizing our inherent value and that having that inherent value live in the policies we organize around and the policies that we write to change this world. And I will also add, like, using this time, using the way we want things to be organized around COVID-19 to live in how we organize in the future too. We shouldn't forget.
Yeah, I want to share that, Black women have cared for this country for centuries. Black people have built this country time and time again. And, it's really not asking for a lot to be economically supported as a base of workers. And that's what we have to remember. We're not asking for anything that we have not, and our ancestors have not already paid for. And that's really important that people understand that.
So I would just add to what's already been said, looking at operating on a micro to the international level. So, sometimes I think we don't move because we think that it's this big piece. But for example, when Sister Jaribu was saying end capitalism, there's ways of thinking that are capitalistic. There's ways, this exploitation, putting profit over people that we do in the micro to one another in our own little spaces. So practicing it, making it a practice, anti-capitalism as a practice, anti-racism as a practice, right? Looking at how we do that in not just in our own minds, right? Because, people will sort of act as if I'm doing everything the way it's supposed to be done and that's okay. But no, we're connected to everyone. And so we've got to do it in a way that connects us to everyone, right? And so I think that's important, but also thinking internationally, because when we look at what's happening here with COVID-19 and some of the harsh enforcement, we can also look up in the continent and see some of that happening. We can look at the Caribbean and see some of that happening. So a lot of the issues that we have, because capitalism is global, because anti-Blackness is global, we are dealing on a global level, and we can look at other people and what they're doing successfully and pull those into our movements as well.
The next question I have for you all is, work has never stopped for many of us, and the work of Black workers have been dangerous even before the crisis. So how do you think this pandemic presents an opportunity for increased organizing? And I also want to add, how do you think this pandemic presents an opportunity for us to move in our organizing with abundance?
I am really bolstered. I know we're all tired of these Zoom meetings, allegedly. We're just sick of them. However, if we look right now, we got people from Canada. We have people from all over the United States. We have people doing all kinds of work. We couldn't pull this together as an in-person convention. It wouldn't happen. People wouldn't have the funds to go. People wouldn't be able to take off the time because, you know, you'd have to have the capacity to get on a plane, to do this, to do that, all of those things. And I'm so thrilled to see how many folks are really making this part work, connecting in a way that we couldn't connect before, getting to know people that we only knew by name, right? Or maybe face or something, and being able to connect our work. You know, the surveillance state exists, so it's not like we can get down and get funky like we can one-on-one, but just this right here with the, you know, hundreds of people who were on this call, it would have been very difficult to do it any other kind of way. And so I just encourage us to continue to take the opportunity to create community. I know it's not the same, and I'm not trying to pretend that we can organize the world by internet. Okay, so no one take me of saying that, but the capacity to connect and the capacity to, you know, to be with one another and to think with one another cannot be underestimated. And so that's something that with worker, you know, with us centering workers in this way will take us to another space as we're doing this work.
And especially in a context where white supremacy has us operate in urgent spaces that, you know, forces us to think that we do not have the room and the time and the spaciousness to sit and congregate with each other, to reflect, to play, Linda, as you said, to just be in community and connect. And we have to remember that that is a way that we center Blackness. That is a way that we build power. Small is all, small is good. And I want to connect back to something that I think, Nana, you said around thinking also about how we're with each other in our spaces. And a lot of us work within the context of organizations. And Rebecca, I would love if you could lift up some of the ways in which your leadership of how we're centering race equity within our internal work in service of our external work, how we've been able to do that at NELP.
Sure, Kemi. Since 2016, NELP has been doing internal racial equity work, and me and my colleague Michelle Rodriguez have led most of it. And it's a really exciting time. And I think about what this moment would be for us as an organization if we hadn't done that work. Because by doing that internal work, folks were actually able to make the connection to how does racism manifest in the economy? So what are the root causes of the things that we need to fix? And so we can actually approach it in a different way and own our authenticity around how we show up in the external work, how we show up with partners, by doing that internal work.
Thank you, Rebecca. And now, as we're nearing time, I'm going to pivot to Jaribu, our host who brought together this incredible, deep, and beautiful conversation to close us out. So my deepest gratitude to you, Jaribu, for creating this space for all of us to be together today. Still muted, still muted.
I am truly a Baptist preacher's daughter. I have courage, and I also have a big head and a big ego. But this is not the time where that's going to come into play. I am not going to recap. I'm not going to do a keynote. I'm just going to say ashe, ashe, ashe. And I think we should close out with Chris, the video, and Aaron and Paige will direct us to that as our closing. And Fannie Lou Hamer, Fran. I just want to say I'm full up to the brim right now. And this is how you do it. This is how we make revolution. We don't let the capitalists stop us from pulling together however we can. The next step is to get across that digital divide, figure out how can we pull our people in who can't get on Zoom, who can't get on the internet. Let's try to make it happen. And so now just turn it over to Aaron and to Paige for the video.
Hey, Drew, we're going to do the acknowledgements. We're putting up the slide.
Yes, if you want to do those and then go right into the video.
Drew,
oh, okay. All right. Just quickly, thank you, Kemi, for moderating. And boy, that was more than moderating. I knew it. I knew that's what it would be. Thank you, Aaron, for your visionary production work and being the producer, the creator and developer. Thank you so much, Paige, for being our willing accomplice and assistant producer in this effort. Thank you to Andra. I don't know if she's on, but your images certainly lit up the screen for us and helped us to push this message out. And just thank you to everybody who hung in there. And over half the folks stayed until the end, and it was over 2.5 hours long. So that just goes to show you we hunger and thirst for this, and we will continue. We will have more. There will be more. And those who are on this web tonight, you know, I got you for life now. You can't run from me, you can't hide. I got your contact, I got everything. So let's let Chris take us out. Aaron, you want to introduce it?
Yeah. Yes, everyone. This is Christian Smalls. Unfortunately, he was unable to join us as he planned. As you know, Christian has been on every news outlet, so he got caught up with his schedule. Just to give a little context, Chris is from Newark, New Jersey. He worked at Amazon. He organized a strike that got the attention of pretty much, it captivated the world. And Jeff Bezos actually had meetings centered on Christian because of the impact that his work was having. And he's exposed the conditions that they're working on. I know there's something that he was going to share, but I'll lift it up. The New York Attorney General's office actually looked into the conditions, and they've actually found what Christian lifted up to be true about the horrible conditions at the Amazon factory. There have been over 30 people that have tested positive for COVID at the Amazon factory. So we're gonna let this video take you out. Before Paige, I just want to say one last thank you, Jaribu. Thank you, Kemi. Thank you, Paige. Thank you, all of our panelists. I know I was emailing y'all so many times. I appreciate you all for just making this a powerful event. I can't wait for the recording. We'll be sending that out. Me and Paige also will be working on a newsletter where we'll have some highlights from the webinar, but also many people have shared some of the resources and mutual aid you have. We'll be sharing that so we can connect and keep moving forward together as a collective movement. So thank you so much. And we'll let Christian take us out. Thank you. It was powerful.
Yeah, my name is Christian Smalls. I'm the assistant manager that put this together. This cause right here is to shut down the building to get it sanitized. We got over 10 cases in the building that we know of. The public don't know, but we're making it publicly known today. We came out here to make a cry for help. We need the government to step in. Close this building down. There's too many coronavirus cases. They're not telling the employees. They're not taking care of us. We're not safe. We got a lot of people that's home right now, unpaid, and it's not right. It's not fair to us. It's not fair. So we here making a statement. We had a successful walkout. You know, we got the message out. We got people aware. That's what we're here for.
Yep, so there we are. Christian was fired. He was let go, but he has attorneys now. They're gonna be filing suits against Amazon for him being fired for as retaliation. So just powerful words and the impact that he's had. And Fran, thank you again for joining us. We didn't tell the story, but we watched your video, and we're so glad you were able to join us and share your testimony. It was very powerful. Jaribu, you have anything you wanted to say before?
I only have one thing to say: revolution, revolution, revolution. Stop, stop, stop catering to capitalism, and let's destroy it. Good night, everybody.
Okay.
Thank you. We love you so much. Thank you, Kemi, for walking us through it. Aaron, Paige, everybody, we love you. Thank you. We'll talk to you the next time. More coming.